All right, so got here at the hospital. I think it's about 5:30. Getting ready for my heart surgery. Um, so last few weeks, I've had some pre-op appointments, some really long ones, but probably the biggest thing that's been going on is just been trying to think through whether I want a heart mechanical valve or a tissue valve. And so the doctor really recommended, because I'm young, to get a mechanical valve. And before I got a tissue valve, and it only lasted me about 7 years. Part of the issue was that I actually have leakage around my valve, so my valve probably would have lasted longer if it weren't for that. Um, but if I get a mechanical valve, it should last me pretty much my entire life. Unless there's something happens that some fluke that something goes wrong. But problem with mechanical valve is that then you're on Coumadin for the rest of your life, um, which is basically rat poison. It's what they use to kill rats. Um, it's not. A lot of people are on it. I'm not worried about actually taking the Coumadin. One of the issues is that I have is that I don't, because I don't eat meat. I eat a lot of plant-based food. A lot of my food is very high in vitamin K, and vitamin K neutralizes Coumadin. So I would have to have even more Coumadin in order to counteract that. And if my diet changed, like too much Coumadin can kill you. I mean, they use it to kill rats because they sort of bleed internally. So. It's just a constant watching your blood clotting, your blood viscosity, and also if your blood viscosity is really low, you cut yourself or something happens like that, then it won't clot and you can bleed pretty bad. You can also bruise really bad. I'm not worried about those things, but it's just that diet and having to be consistent with it. Often I'll eat, large salads. I love kale, large kale salad. It's one of the highest sources of vitamin K, so it would neutralize the drug that I'm taking. So, so I seriously thought about it. The first time I'm like, no, I want a normal life. I don't want to have to deal with this. So I got tissue valves. The doctor was, really wanted to do mechanical valves, so I considered it, but I felt like I felt conflicted. Like the whole time I'm thinking about mechanical valve, I researched it, and in fact, the more I researched it, the more conflicted I became, until I finally thought, no, I want to do a tissue valve, and then I felt good about the whole thing again. And now the problem with the tissue valve is that in another, 5 to 20 years, I'm going to need another valve and maybe another one. Some of the advantages or some of the hopes, I guess, with getting tissue valve is that the technology is going to improve, and so the techniques and all those things will get better, and so tissue valve won't be so bad. And I think also it comes down to just wanting to live a normal type life. I just wanted to be able to eat normal and do what I want normal, not worry about drugs, not worry about testing my blood viscosity weekly or bi-weekly or monthly or whatever it might be. So that's something that a tissue valve can give me. Now, some of the complications with tissue valve is that of repeat surgeries. There's going to be scar tissue. There's going to be other issues because of repeat surgeries. Again, my hope is that technology improves. Maybe next time they'll be able to do a less invasive, because they're going to have to cut me open, full open heart surgery, and but maybe next time it won't be that bad. Maybe it'll be more, through the rib cage or through a main artery in your leg. There's been quite a few advances. That's not an option for me this time because of the leakage happening around the valve. But it could be something potentially a potential option for next time. So anyway, here we are. I'm not allowed. I had to totally, wash down last night. They gave me special things to wipe down with, and Um, not allowed to. I wasn't allowed to shower this morning. No hairspray, so my hair's um, it needs to be managed somehow. So that's why I'm wearing the bandana. But anyway, I'm not actually too concerned about the surgery. I feel like everything's going to go fine with that. Everything, I'm young, I'm pretty healthy, so everything should be fine. The hard part for me, as far as my biggest concerns are, is the recovery. How soon can I get back to work? How soon can I, do the things that I enjoy doing? So, yeah, those are my biggest concerns, because I don't want to. I don't know, that being recovering for weeks is a difficult prospect for me. So anyway, that's the update. Again, so we're about to go in surgery. I'm actually the second surgery today. We were supposed to be scheduled for yesterday, but they rescheduled for us today. I guess now we're second. And anyway, I've got a good doctor. I'm hopefully that everything goes well, and his years of experience will pay off, and it'll be pretty easy. Anything else?